Hello, everyone. My name is Mike Nilsen, and I'm a physical therapist at Intermountain Physical Therapy. And I'll be presenting my poster titled Impact of Alternative Video and Phone Visits on Patient Volumes and Outcomes During COVID-19. So I just wanted to show a general overview of the poster here, and we'll kind of break it down and go through in slide format of each of these sections, starting with the background, working through methods and results, and then you can kind of see some of the figures in slide form as we work through the poster. So just a general background, as we're all pretty well aware, the COVID-19 pandemic has had a significant effect on the healthcare system, stateswide and even worldwide. One of the areas that we saw an impact was our patient volumes at our outpatient physical therapy clinics here at Intermountain Healthcare. So in order to address this and better serve our patients' needs, we wanted to figure out ways to accommodate our patients during this time when they had various reasons they weren't able to come into the clinic. So in order to do this, we began to offer phone visits on March 17th. And then shortly after that, we developed a process where we were being able to provide video visits for patients as well. So the general purpose of this project or this poster is really we wanted to see the effectiveness of these phone and video visits in looking at two things. We wanted to see how well they did at maintaining patient volumes, and then how well they did in terms of maintaining our patient outcomes, and just to ensure that we were providing the quality of care that we found acceptable and that we really wanted to provide for our patients. So in order to do this, what we looked at is we decided to look at similar timeframes between 2 years. So we looked at 2020 and then also looked back at 2019. We opted to start this time frame on March 17th, which is when we first implemented our phone visits, and then extended this for the next 3 months, just straight through to June 17th. So we looked at those snapshots of those two timeframes again between 2019 and 2020. In terms of looking at patient volumes, we just really looked at this by number of patient visits and comparing those between the 2 years. Our patient outcomes were tracked by using the metric called failure to progress, where failure to progress is the number of patients not achieving the minimal clinically important difference on their patient reported outcome divided by the total number of patients. So this would be reflected as a percentage, where the lower the percentage indicates better patient outcomes overall, meaning that fewer patients weren't hitting that threshold to consider a successful outcome. Overall, we saw 2,700 patients, which accounted for almost 22,000 visits between the 2 years. So how did things work out? So as I'm sure most of you experienced in your own clinics, if you're treating in the clinic, we saw a pretty significant reduction in patient volumes, unfortunately. So our volumes between 2019 and 2020 were essentially cut in half. But what we ended up also seeing was we saw an improvement in our failure to progress rate. So we saw that number actually decrease. So that meant that the patients that we were seeing, a higher percentage of them were achieving a successful outcome. So coming back to our conclusion, what we thought by seeing this information was that these alternative visits may be an effective supplement for clinic visits in terms of certain patient populations, in the sense that it did allow us to provide the quality of care that we were looking for and achieving successful outcomes in our patients. However, on their own, they were not necessarily enough to maintain our patient volumes, and that could have been due to various reasons, whether that's a reduction in elective surgeries and other factors that kind of led to a reduction in patient volumes. So I want to thank you for taking the time to view my poster, and I look forward to answering any questions that you may have in the Q&A afterwards. I've just put my references up here as well. They'll also be included in the poster.